welcome. Today's article is titled Clinical Efficacy of Sealer-Based Obturation Using Calcium Silicate Sealers. It's a randomized clinical trial done by Korean group and published in Journal of Endodontics in 2022. Recently, a sealer-based obturation technique using calcium silicate sealers has become popular because it's less technique sensitive, requires less armamentarium, and is easier to perform. However, sealer-based obturation with calcium silicate sealers has never been compared with traditional compaction techniques. Therefore, the purpose of this study was to evaluate the clinical efficacy and outcome of sealer-based obturation when used in conjunction with calcium silicate-based sealer and compare them with continuous wave condensation technique with a resin-based sealer. Now, moving to the methodology, this study was designed as a randomized controlled clinical trial to compare postoperative pain, quality of root canal obturation, and short-term clinical outcomes. Patients were enrolled from the outpatient clinic of the Department of Conservative Dentistry and College of Dentistry in Korea. And the exclusion criteria were as follows. Patients who were unable to communicate their symptoms because of psychological disorders, the tooth was affected by cracks, severe periodontal bone loss due to chronic periodontitis, accompanying mobility of the tooth, etc. And the root canal was not negotiable with 2 millimeter of the radiographic apex. And finally, if the tooth was not ready for root canal filling at the next visit after canal enlargement because of signs and symptoms. For the sample size, a sample size of 50 teeth per group was determined and included. And for the treatment procedure and randomization, teeth were treated by 6 dentists. All procedures were performed over at least 2 visits. If there were no or only minor signs and symptoms at the next visit, the patients were invited to participate in the study. And according to the random numbers on the list, each participant was provided with an enrollment number and randomly assigned to one of the 2 groups based on the obturation protocol, either continuous wave condensation with AH+, or sealer-based obturation with BC sealer. Now, moving to the outcome variables, which are postoperative pain. The patient recorded their pain on a 0 to 10 numeric rating scale. Patients were required to report their pain level at the following times: 4, 24, and 48 hours after canal obturation. And for the quality of root canal obturation, it was evaluated in terms of sealer extrusion, root filling voids, and the level of root filling. And 2 blinded and calibrated examiners evaluated the periapical radiograph taken immediately after canal obturation. And for the healing outcome, the participants were recalled after at least 6 months, and radiographic and clinical examination of the treated tooth was performed. The teeth were divided into outcome categories on the basis of the following classification: either healed, healing, or diseased. The healed and healing categories were classified as success, and the diseased category was classified as failures on the basis of loose criteria. And according to strict criteria, the healing and diseased categories were considered as failure. Now, moving to the results. Of the 90 patients enrolled, 3 were excluded because of advanced periodontitis or unrestorable fracture of the treated tooth, and 19 patients were lost to follow-up within 6 months. Accordingly, 68 patients and 74 teeth were included in the final analysis, and the mean follow-up period was 17 months. So 66 of the 74 teeth showed no or mild pain, which correspond to a percentage of 89%, and 8 teeth triggered moderate to severe pain after root canal obturation, and the 2 groups expressed identical distribution of postoperative pain. In regard to sealer extrusion and long filling length, it was found more frequently in the continuous wave condensation group than in the sealer-based obturation group, but the difference were not statistically significant. As for the total success rate of the root canal treatment, it was 93.2% on the basis of loose criteria, and the continuous wave condensation and sealer-based obturation groups showed 92 and 94% success rate respectively, and no statistical significant difference between groups were observed. The teeth with necrotic pulp had the highest success rate, followed by retreated teeth and teeth with vital bulbs with significant difference. And teeth with sealer extrusion showed significantly lower success rate than those without sealer extrusion. So the multivariate analysis using logistic regression identified Sealer extrusion and postoperative pain as possible predictor of treatment failure, although those were insignificant. And according to strict criteria, the total success rate of the root canal treatment was 60.8%. The sealer-based obturation group showed higher success rate, 71%, than the continuous wave condensation group, which was 51%, but the difference was not significant. So although this is a well-designed study, it has a major limitation, which is it did not fulfill the required sample size because of the limited time for patient recruitment, as mentioned by the author in the discussion part. So to conclude their findings, within the limitation of this study, it was found that sealer-based obturation using BC sealer can be a possible alternative to continuous wave condensation using AH plus sealer, and sealer extrusion and postoperative pain negatively affected the outcome of root canal treatment, and the further follow-up and other studies with a larger sample size are needed for better reliability.